Hello, hello. You're welcome to the Overcoming Infertility podcast. Thank you for tuning in once again. The month of June is World Infertility Awareness Month, and to mark this month, we host a special guest for each weekly episode, and each guest is an expert in their field, and they'll be sharing their story, their mission, and providing key takeaways for listeners on how to overcome any fertility challenges they may face. Our topic for this episode is the importance of male infertility. And I have the privilege of interviewing my special guest for the day, Dr. Ede Omokhudu. Dr. Ede, welcome to the show.
Thank you so much, Dr. Anna. It's great to be here. Thank you so much for having me.
It's great to have you. Thanks. Thanks for
Awesome.
coming in.
Awesome.
So, just a little bit about you. Dr. Ede is a medical doctor with over 15 years of experience in healthcare. He is a wellness expert. He's a story and narrative consultant, a creative, a book and script writer, and an all-around tech geek. So we'll get right into it. I was so eager to get you in to discuss this topic because of your background, because of your gender, and because of your expertise, and also because it's been difficult to get men to talk about infertility. So, can we start with the basics? What is male infertility, or what is male factor infertility?
I like the fact that the word factor. So male factor or male infertility, really, it's infertility by virtue of its definition obviously means one's inability to procreate to the next level or the next generation. So the male factor basically means the inability of the man or the male in this case to sire an offspring through the normal sexual or evolutionary channels.
Okay. Okay, great. So what are some of can you just give us a very basic overview of the male reproductive system and how it's supposed to work, including important stats for things like sperm count and sperm analysis?
Fantastic. So, you have the normal male anatomy, which is a man has a penis and has testicles as well, and a scrotum sac or scrotal sac. The scrotum really is just the bag that houses the testicles where sperm production occurs. Now, once the male is aroused, obviously, they have sexual intercourse, and then the sperm basically gets deposited into the woman's body, and then swims up, goes to meet the eggs, and then fertilization occurs. So now, in terms of the male, then that's just the anatomy. So definitely you need the penis, and then you need the testicles. Now, sperm production itself requires certain conditions. All right, so which is one, the optimal temperature, which is why in cold temperatures the natural the temperature required for sperm production is it's a very highly regulated temperature, meaning when temperature is cold, then the scrotal sac shrivels up like a walnut, basically to bring the testicles closer to the body, again to keep the temperature optimal. And then when the place is hot as well, or the weather is hot, then you find that the scrotal sac tends to sag a bit. The men in the house, you would know, right? So that happens. Then in terms of the number, on average, the normal ejaculate within a normal volume of ejaculate, right? It's expected anywhere between 40 to 200 million sperm. That's the normal range, it's considered normal. Below 40, all the way down to 15. That's basically from 39 to and below. Then it's considered to have low sperm count. Doesn't mean it can't happen. Again, it's all time and chance. But the chances are drastically reduced when there's low sperm count. Then also some healthy ejaculates, volume sperm collections can have as much as even 300 million sperm, in there. So again, it just
So it's a
has
range.
that range. Yes, a range.
What about the shape? Because I know that there needs to be a normal physiological shape for it to function and for it to be able to By it, I mean the sperm, to be able to function and to fertilize an egg.
Exactly. So typically, it's, for lack of a better analogy, think of a tadpole, right? Now, I'm not saying you have tadpoles, right? Right, but
I
you
know
get
I
the idea.
don't.
Right. So definitely, right. Just think of it. So basically, there's a head, slight small body, and then it's got a tail. So typical anatomy of a sperm. They're really tiny. Tiny. You require a microscope to actually see them. The male sperm are naturally very small compared to the female sperm, which is much bigger.
Which is why the man is responsible for the gender of the child. Excuse me.
Exactly.
Because you have male and female sperm. Well, you have sperm that
Exactly.
can determine if the child will be male or female. That comes from the
Exactly.
sperm and not from the egg.
Exactly.
So, Dr. Ede, I was
All
wondering,
right.
there are quite a few misconceptions about male fertility.
Yeah.
Are there one or two in particular do you think we need to address?
Okay. So yeah, size matters. Not right. So you tell you, oh, size matters. Oh, the bigger the penis, the bigger the fertilization potential. All those things doesn't hold any water. To be honest, that
Mm,
has no bearing whatsoever on the quantity and the quality of the sperm produced. Again,
mm,
so long as isn't a micro penis, right? It's able to, the person is able to have sex properly, and deposit the sperm there. The sperms, they're naturally swimmers; they will find their way, right? So once the quality and the quantity of sperm are adequate, right, then fertilization naturally can occur.
okay.
So size matters. Again, like I said, not really.
Not for fertility, so to speak. Okay, cool. Thanks, Dr. Ede. So
Yeah.
now let's get into the meat of the actual causes of male infertility. What are the top causes of male infertility and how can we address those causes?
Okay. So one has to do with, again, anatomy. If the man, in this case, or the young adolescent, has undescended testes, then that can be a big problem, because
Okay. So
again,
that's like
as
a
we said,
developmental, from the developmental
exactly,
ages,
exactly.
from
Thank you from
babyhood.
development. Exactly.
Okay.
So it's a very crucial one. So if that doesn't occur, the testes do not descend, then there's a problem, and it can affect fertility, because over time the testicle would have lost functionality, which is why for parents of young boys, as young as they are, once they're babies and everything, just check. If the testes have not descended, that you can catch it early, and they can do some, an operation, a surgical procedure to help the testes descend,
Hmm.
and then get it to stay. So pretty much what they do, like, I'm just going to grocery out, right? What they do is just bring it down and just staple it there. No, no, sorry. It's called Okido Pexi,
Yeah, that's
right?
for those that need it. And you don't need, I don't want you freaking out any of our listeners. So the point is
Yeah.
that from birth, from birth up until a certain age, you actually expect
Yes.
for both testes to be found in the scrotal sac.
Exactly.
So if as a parent you have checked, so from babyhood, right? From the
Yes.
newborn
Yes.
stage, you check the scrotal sac of your male children to be sure that the testes are in there. And if they are
Exactly.
not, um, then you need to get medical attention for that. It may require surgery in which the testes is pulled down from the abdominal cavity into the
Hmm.
scrotal sac. That's a
Exactly.
nicer way instead of telling, oh,
Exactly.
James,
Let's
I'm
let's
going to
let's
staple
let.
it. Everyone will be scared that, oh my God, what's happening? Why are you stapling? Why are you stapling the testes
Oh,
of children?
oh my
Okay.
goodness. Mm.
Okay. So what other I don't think that's very common though, even though it's important to mention it. So I'm glad you brought
Oh,
it up. What
yeah.
other common causes of male infertility do we have?
Infections.
Mm.
Infections. As a matter of fact, sexually transmitted infections, even UTIs in some cases too, can really, really. I mean, even if the person hasn't been sexually, sexual, careless or anything, sometimes
Mm.
they just pick it up from very poor sanitary toilet conditions, and it can lead to infertility. For example, one of the key ones that is even it's kind of scary too is chlamydia, because chlamydia nobody would know. There's no symptoms. That's the funniest thing. Clams is they call it clams, right? It's very very. It's like a not a
It's
wolf in
like a
sheep's clothing,
silent
but
killer, so to speak.
yes, a ninja of bacteria, as it were, right? So you're just going to go there, infiltrate your farm, and then whilst the farmer is sleeping or whatever, kill all the chickens and just it
In this
nukes the
case,
whole.
is it the sperm that are the chickens? Just to confirm.
Yeah, yeah. For the analogy, right? Yes, but
Yes.
that's what it pretty much is what it does, and you wouldn't even know. It's when, and it's unfortunate because when the person wants to start having kids, then that's when they realize, okay, some damage has been done years ago, right?
Mm-hmm.
It's a very sad occurrence. Doesn't mean that chances that the person can't be fertile, but then again, it does a lot of damage. So it's something you want to be, very
Yeah.
careful of. So again, safe sex, or just avoid abstinence altogether until you're ready, the right partner. Again, that's what I would
Yeah.
suggest. Also things like staph aureus, other things too can also cause again. So it's something to be very mindful of, UTIs and STDs.
I like this, Dr. Ede. Excuse me. Because it's so important that nothing is really in isolation. So even though we're talking
Nothing.
about, so even though we're talking about male infertility and the causes, then you can't avoid talking about what you just said, things like um, the reasons for abstinence and for safe sex practices, because
Yes.
then you're keeping your reproductive system as healthy as possible by avoiding infections.
Hundred
Um,
percent.
yeah, because some of these infections then go on to have more, semi-permanent effects, such as, you know, if there's permanent damage to the sperm count or to the
Exactly.
testes, and they can't produce sperm anymore like they
Hmm.
used to. So it's something that our listeners need to be mindful of. So thank you for
Very.
bringing that up. And then I
Thank you
also
so much.
remembered something else in terms of, like, chronologically. There's also something else that does a lot of damage.
Oh, yeah.
It's not as common as it used to be, but it still happens. Mumps, like when
Oh yeah.
young boys,
Exactly.
when young
So which is
boys
why
are exposed to the virus at a young age.
exactly, and this is why although based on my calling as a doctor, I would just advise parents, especially to get them vaccinated when they're kids,
Hmm.
especially for vaccines that you have had a track record of showing that there's very effective. Because moms again, young age neuters them, very painful.
Yeah.
So it's not something you want to happen to your kid.
Yeah. So it's good that
One
that doesn't happen
one other
as
one,
frequently as it used to.
that comes to mind now is things like varicocele, right?
Oh, I think that was the next cause of infertility you're going to mention.
Yes, that's another one that comes to mind. So
It's
varicocele,
a major
right?
one.
Oh yeah, yeah. Basically just chokes up. Basically, varicocele, for those who don't know, venous contortions really that happen around the scrotum. So basically, the long and short of it, it makes the place very tight, unconducive for sperm production, increases temperature, very painful if left to progress after a while. Sensitive. It's not something
Mm.
you want to have. So you notice, anything that looks like a little worm or whatever, and just post your doctor immediately,
So just to be
right?
clear, a varicocele is a collection of engorged veins. So the
Exactly,
veins, so even though they look worm-like, they're actually veins. They already exist in the body and in the
exactly,
scrotal area, and then they become
exactly.
swollen.
Yes,
Okay.
and it's very painful, right? It's painful
Mm.
and uncomfortable as well. So you notice anything that looks weird or it's not supposed to, or misshapen in a way,
Mm.
please, um, rush to see a doctor.
Okay. Great. So those are some of the major causes of male fertility. What advice would you give to a man who is struggling with infertility, whether he has some of these conditions or not?
I would say first and foremost, Be positive. Be positive because, again, it's not, infertility is a medical condition. We're an age where, we're currently in an age where information is rife, it's everywhere, right? You have tons of, medical professionals, knowledge is everywhere. Like it's really, really, it's been something that has been battled with for lots and lots and lots of years, heavily researched. So definitely there's much more there's tons of options in terms of trying to find the root cause of the infertility, and then also fixing it as well. So the first thing is to, let's be thankful that we're in this age. Secondly, it's a medical diagnosis, right? It's not an inadequacy of your character or your self as a man, because you know how society or culture tends to say, oh, you can't decide a child, you're not a man. No, trust me, there is. That's what I wanted to tell men. There's hope, and you can find that hope by reaching out. The problem is that as men, we have a problem with seeking help. Okay, so for me, that's where I want to also encourage any man going through this right now that please just seek help. It's not unmanly to search for help. Matter of fact, it's even more manly to search for help, get a solution, because men, by virtue of our social identity and everything, should be the ones to try also seek solutions as well. So by reaching out for help is the first step towards getting a solution, and that's even much more manly than keeping it to yourself.
I like that. So if the issue is the stigma of how perhaps it's affecting your masculinity, that's another
Exactly.
misconception. It's not true.
Exactly.
It's not
Exactly.
true. Yeah. Thank you. Thank you for speaking to the audience. We do have a lot of this podcast has over half of the audience is actually male on a consistent basis.
Well,
And yeah, and it's I find that first of all very interesting, secondly very encouraging, because it means that men are ready to, they may not be as vocal yet, but at least
exactly.
they're seeking information, they're listening, they're watching. And I know that the information you have shared will be very helpful. So maybe just as a very quick overview, I would say to anybody listening, male factor infertility is a major part of infertility. The old concept that everything about getting pregnant and having a baby was on the woman is incorrect. The male contribution is 50% literally, because if you don't have a
Oh
sperm
yeah.
to fertilize the egg, then nothing is going to happen. Um, there are certain misconceptions that are not true. You're not weak if you've not had a baby yet as a man.
Mhm.
You're not unmasculine if you're seeking help. Um, Infections are important to treat if you're sexually active, because it can affect your sexual and reproductive health in the future. Um,
Yes.
Childhood male care is also very important. So check the baby's growth or sacs. If your son has mumps, treat it quickly so that there are no permanent results later when he's in adulthood.
A lot of times, for a lot of couples, timing is so crucial. Time and chance, as they say, right? But timing, because sometimes the cause of that delay or infertility may be time. So if you're not getting it at the right time, it's just a very small, narrow window for fertilization to occur. So obviously, the way God has done it or nature has done it is the way that there's a balance. So sometimes, some sperm can last as long as 48, 72 hours even. So that way it gives a leeway, depending when the egg comes out. So there's still some, wiggle room in terms of timing. But time and chance really is one of the crucial things that everyone who is trying to get conceived should also take into account
Okay,
as
but
well.
just to be clear, Dr. Ede, you're referring to the natural rhythm method um, of conception, isn't it? In terms of
Yes,
looking at that
yes,
natural window where
exactly,
it's best for fertilization to take place during sexual intercourse.
exactly,
Okay.
exactly, exactly. And this also tends to also affect a lot of religious couples too, who Now, even if sometimes they get time or whatever, they also having sexual intercourse frequently enough? And I've seen this in a lot of religious circles too, where some will say, "Oh no," and you find out that it's just only once a month,
Mm.
right? They're having sexual intercourse. It's not nearly enough. So that could be another issue as well. So again, you want to make sure you tick up all the boxes: regular, unprotected sexual intercourse, with your spouse, and then also ensure that you can also try and get the timing right. Diet is such a crucial issue. Certain foods we eat, reduce testosterone levels. As a matter of fact, when a man hits the age of 35, his testosterone level plummets so hard, right? And it starts to go plummet until forever. So from 35 and up, it's such a crucial factor to ensure you boost your testosterone level. So again, good diet. It's a diet that is rich in this protein, zinc. It's very crucial to really help with sperm production, and your natural ability to produce as much testosterone again reduces. So one of the things that helps to spike it, right, for most of the men, exercise, carry heavy stuff, lift heavy stuff, right? Go to the gym. Don't go and do cardio. We're not begging for cardio. Cardio won't do anything. Lift heavy
Well,
stuff,
cardio
bag
would
of
do
rice.
something. It's just that it has
Yeah,
to be
yeah,
the
but
right proportions. Yes.
exactly, because it's
Yeah.
not, fat loss and everything, and eating a healthy amount of fats too. It's weird, because the current the world right now, has been leaning more towards heavy plant based and so on. I would be a bit contrarian here, and I'll tell you that you need to eat like foods that have natural fats.
Mm-hmm.
Okay, stearic acid, butyric acid, all those things. Those things help in hormone production and stabilization. So you want to eat the right amount of fats as well from healthy sources, preferably I would say from animal sources. Healthy fats you can get them from, but healthy fats from good oils like coconut oil is great. Palm oil, believe it or not, is amazing. Olive oil, animal fat, you can get it from butter as well. So that's like real good fats. They really help with hormone balance as well for
Okay.
both parties, actually. Yeah,
Okay. Okay. So basically, the entire healthy lifestyle, working out, staying fit, strength training, and then watching your
exactly. Strength training.
nutrition also affects fertility for sure. So those are things that we need to be conscious of and intentional about. Great. Thank you. Thank you, Dr. Ede.
Thank you so
Thanks for
much.
joining us on the show. I know the time has been short because even with the discussion we've had, I'm sure my eyes are like all over the place. I'm really thinking, okay, we need to talk about this, we need to talk about that. We need to delve deeper, into, the many potential subtopics. But overall, I think and I hope that this has been encouraging. So thank you again for being on the show. Thank you
Thank you so
for
much.
for
Thank you
your
so much.
time and for your
Appreciate it.
knowledge.
Thank you so much.
Great. And perhaps we'll have you back on the show
Yeah,
for
thank you so
another
much.
related topic. Yeah. And to those of you listening, thank you so much for tuning into the show. I'm sure that hearing details of male infertility, including some of the causes and some of the way to address those challenges, will help those on this path move from where they currently are to where they should be on the journey. So remember to always improve your awareness, seek out medical information, seek out medical attention. Don't be afraid to speak, to check, to go online, to see your doctors, see your GP, see your gynecologist. Go with your wife when she goes to the hospital. Don't just leave her to do everything by herself. And hopefully, listening to a fellow man talk about infertility settles better than from a woman because you men understand each other better than
Wait.
the
Oh
same
yeah.
way women
Oh
understand
yeah.
each other better. But hey, let's not
Bro
go there.
code.
But we're here for each other, which is what matters the most. So thank you, and we'll see you again on the next episode. Bye for
Thank you so
now.
much, Akano.